I'm an environmental psychologist by background, which basically means I'm interested in the way different environments make us think, feel and behave. And I was going to start the presentation with a little experiment. Is there anyone, I want you to raise your hands if you don't think that being near the coast is good for your health or well-being. One tentative statement there. Well, I'm going to be presenting to you on what you already know, essentially, that it is good for our health and well-being. But firstly, I'm not going to ignore the fact that there are plenty of risks. There are harmful algal blooms, there's plenty of destruction of fisheries, there's a lot of antibiotic-resistant bacteria in the ocean, a lot of man-made chemicals make their way into the ocean. And what's not up there is that drowning is the third biggest cause of accidental death in the world. So why do you all like being by the coast? It's terrible for your health. Like, you're exposed to all of these risks all of the time. But as well as those risks, there are opportunities too, and this taps into a really rich history. Back in the Victorian era, it was very common to receive your treatment at sea bathing hospitals, and Dr Fortescue Fox wrote quite extensively about convalescence at the coast. And also a big spiritual history as well. It's no coincidence that Jesus was baptized in a river, or that the Hindus use the river Ganges as a source of spiritual replenishment as well. So the ideas I'm presenting in this presentation aren't new. They're definitely got a historical and a spiritual context. So we set out in 2012 to say what is the association between exposure to coasts and good human health. We thought, what is the biggest sample of people we can recruit to try and determine whether there is a robust association? So we used the English census. So we had data from 48 million adults in England. And in the census, you're asked how you think your health is these days. And you can pick from 5 different options. And it may sound quite simple, but these kind of questions are big predictors of mortality and longevity. And we also have everyone's address, of course, in the census. So using a GIS system, we can work out how far every individual in England lives from the coast in a kind of crow-flies distance. And what we find is that the closer you live to the coast in England, the better you think your health is. What's particularly important from my perspective is that these effects are actually strongest in the poorest communities of England. So if you're of lower socioeconomic status, for example, the benefit of being near the coast in your house is even greater on your self-perceived health. And we also see the same pattern when people move home. So when people move from an inland location to a location that's within a kilometre of the coast, you see a dramatic increase in their health, which actually sustains over a 3-year period. So we know that there's an association, at least between the coast and self-perceived health, and there's various different mechanisms that this can work through. The first is stress reduction. There's also exercise promotion, so these are places that we can actually be physically active. There's also different environmental qualities at the coast to other locations. For example, better air quality could be a mechanism. And there's also a social dimension, which I've blurred out a bit there because I just don't have the time to talk about everything we've done. But I'm going to look briefly about the research we've done concerning the other 3. So firstly, looking at stress reduction. There's a survey commissioned every year by Natural England called the Monitor of Engagement with the Natural Environment Survey. And this asks a representative sample of people in England about their visits to different types of natural environment. So in this study, we took about 4,300 visits, and we know whether these people visited an urban green space like a park, a rural green space like the countryside, or a coastal location. And they're also asked in this survey to what extent they felt relaxed, calm, refreshed and revitalised after their visit. And taking all 4 together, we can make a composite score that represents stress reduction. And what we find is that all visits to natural environments are good for reducing stress. But actually visits to the coastal environments in England are much significantly more stress reducing than visits to urban green spaces. So all visits are good, and so I encourage you to get out into nature more, but there seems to be something particularly special about coastal environments. Another way we've researched it is in a clinical setting. So what we had in this experiment was a sample of people that underwent a dental procedure, and they wore a virtual reality headset. And either they saw a virtual dental room like you would in a normal dentist's office, or you saw a virtual beach. And this beach was actually of Wembury, for anyone knows Wembury, down near Plymouth. And what we actually find is that when they see the beach, they're experiencing much less pain in the procedure compared to if they're seeing the dentist's office. And quite importantly, they're actually recalling less pain a week later, which means people are probably more likely to go back for repeat treatments if they've got a comforting environment to look at. It's no coincidence when you go into some dentist's office and they have aquariums or pictures of stars on the ceiling. It's just the kind of evidence for those kind of things wasn't there before. The second sort of mechanism we've researched quite a lot is exercise promotion, the idea that coasts can be places where you're physically active or that promote physically active behaviours. Again, using Natural England's survey, this time we took a huge sample of 183,000 people. And in the survey, they're asked how many days in the last week they've done 30 minutes of moderate intensity exercise. And most of you are probably aware that the government guidelines are that we should do about 5 episodes per week of 30 minutes moderately intense activity, such as brisk walking, for example. And again, using these GIS systems we find that people who live within a kilometre of the coast are much more likely to be hitting these exercise targets that the government sets compared to people that live over 5 kilometres from the coast. Again, it's all self-reported, so we're trusting people that they're telling the truth. But nonetheless, we see this pattern. And you're thinking, well, okay, it's just a pattern. Maybe people that live near coasts have better access to gyms or other health-promoting resources, or they're richer. But actually, we've adjusted for all those sorts of variables. And what this study looks at is actual visits to these kind of coastal environments. And what we find is, compared to green spaces, the coastal environments actually afford a lot more energy expenditure. And importantly for us, people that live under a mile from the coast, this pattern is actually even more dramatic. So even in comparison to these open countryside spaces, coastal environments seem to be promoting higher volumes of physical activity. And we're also now looking at trying to cost these exercise experiences. I've highlighted surfing here because I thought it'd be something that a lot of people in the room were interested in. So this uses the UK Water Sports Survey data. We know that there's about 42,000 people that do surfing in the last 4 weeks in any given 4-week period in a year. And each of those people would on average do that about 5 times. So that gives us an annual frequency that the average surfer would go about 65 times a year. And there's in total about 2.7 million episodes of surfing. We know that the median duration of any surfing visit is about 90 minutes. And we also know that this is associated with a certain rate of energy expenditure. And using that, we can create this estimate of how much yearly energy expenditure is created by surfing alone in the UK, which is this 739 million figure here. You don't have to worry about what that figure actually represents, but the point is we can turn that into an estimate of what we call quality adjusted life years. So basically, we know that this much energy expenditure reduces the risk of a number of chronic conditions by so much. And using that, we can actually work out how many extra years of life across the population would be spent in good health compared to poor health. And the NHS is willing to pay for you to be in a state of good health for an extra year by a certain amount of money. So a low estimate is about £7,000 and a high estimate is about £23,000. So we can very tentatively state that actually surfing across the UK population in a given year is worth about £9 million to £30 million to the UK society. So this reduces healthcare costs. So there are economic savings to be made from the coastal recreation that we all undertake. We're also interested in different environmental exposures that you get at the coast. Most of this research has been done around things like air pollution or exposure to vitamin D or UV. But I thought I'd go with something a bit more fun, I think. We had a colleague at the National Marine Aquarium in Plymouth, and there was this opportunity to do a natural experiment because one of the biggest tanks was being restocked. And so at one point it was empty, there was no fish in there at all. At another point they'd introduced some species, about kind of a low 2 to 10 fish species. And then at a further point there was a total of 19 species. And what we did was both visitor observation and participant studies in the aquarium to see how people's behaviour changed. So the first thing to say is that we saw an increase in the amount of time that people spent viewing the exhibit with the increasing number of species. But also we'd done some experiments and we had people sit in front of the tank for 15 minutes. And what we actually saw was that with increasing biodiversity in that tank, people's heart rate actually went down and down and down with the increasing biodiversity, which suggests that a variety of biodiverse fish in this aquarium setting has actual physiological stress-reducing properties. And we also know that it makes people feel a bit happier and a bit more alert when there are a higher number of fish species in the tank. So that's the kind of research we've done to date. We're very fortunate that at the beginning of this year, the European Union have given us an awful lot of money to do research on the health and well-being benefits and detriments of interactions with Europe's waterways. So this goes beyond just coasts to rivers, lakes, seas, swimming pools, ponds, fountains, all these kinds of environments where people recreate. We're a really diverse team from 8 different countries and 9 different institutions, and we all have disciplinary backgrounds in things as far as engineering, ocean science, epidemiology, psychology, climate science, and all these kinds of things. And just briefly, I wanted to run you through the kind of things that we're beginning to do in this project, but I can't show you any data yet, as it's only sort of a year in, or less than a year in. So us in Exeter, we're doing a review of literature on the oceans and human health. We're synthesizing data sets from across Europe to try and establish whether any of the associations I've talked about today are present in a European context. We're very fortunate by being an island state, but for example, how do landlocked countries relate to their local water bodies, for example? We're also administering a bespoke pan-European survey that actually looks at all these associations in more detail. Our partners in Spain are looking at large-scale interventions, things like improving access to rivers and how this affects people's health, particularly in deprived areas. In our 4th work package, we're looking at virtual waterway environments and how these can be better used in healthcare settings, so kind of like the dental stuff I was showing you. But also we're working with a palliative care unit in Plymouth to see if these experiences can help reduce the pain of the treatments that they're put through. We've got landscape architects in work package 5 that are doing small installations in waterside environments to see if these have any temporary improvements in people's health. We're also looking at how future scenarios such as climate change or changes in migration, changes in economy could affect all of these benefits that I've been talking about. And then we also have another work package looking at how we translate this evidence into policy making, and a further one that says how can we translate it into business recommendations and academic recommendations, for example. So in conclusion, I've told you what you already knew, that people who live near the coast are happier and healthier, and people that visit the coast tend to have happy and healthy experiences. But it's really important for this quantification to happen, because I don't want to promote marine conservation just for marine conservation's sake. I want to put marine conservation into the public health strategy, into urban planning strategy, into all these kinds of, into an economic strategy, something that Richard talked on a minute ago. So it's not just for marine conservation's sake. I'm really interested in preserving human health, and I think the preservation of coast is vital to that. And our future work will look at whether there's any consistent patterns across Europe, and it'll be exploring a number of other questions, such as what's the optimal dose for these health benefits that I'm talking about? How can we really optimize it in a healthcare setting? How do things like climate change and sea level rise affect our relationship with the coast that we have? And also, we're very fortunate to be people that live and go to the coast, but a lot of people don't have those opportunities. So how can we take the research that we've done and translate this into settings where people don't have this kind of access to the coast? That's a priority for me. So please check out the website of our project and follow us on Twitter. And thank you all very much for listening, and thank you for inviting me.